Well, welcome back to Cel Sci's, a channel dedicated to the research and development directed at improving the treatment of cancer, autoimmune, and infectious disease. Joining to touch base on some recent news and then kind of go to market here with some of the regulatories toward, obviously, Multikine. We have Geert Kirsten, as always, the CEO. Welcome, sir.
Well, thank you for having me again.
Always a pleasure. So yeah, I guess the real question at this point is kind of the growth and scale moving forward, because you have this incredible, tremendous data, that 73% survival with Multikine versus 45% and that control with head and neck cancer at 5 years. Do you want to kind of break down at this point what it's like from a regulatory standpoint? How does that go-to-market scale look?
It's all the meetings with the regulators have been very positive. And so a lot of people think that you just send them a few pages of some data and they look at it and they meet with you next week. And, it would be nice if it actually happened that way. It doesn't even happen that way. It didn't even happen that way for the COVID vaccines. We all know they took every shortcut possible plus a million more, right? So it's a process. There's an enormous amount of data that's being put together on the many, many meetings. The one thing I also realized is you have to meet with people many times over to gain their trust, right? So the big advantage that Merck and Pfizer has, for example, is they're well known. So it's an honest broker. We come in as a small company. We have to establish ourselves as an honest broker. So we've been doing that. And I think it's a good thing. I think we're seen positively. And the regulators are telling us they want to help us bring the drug to market. We have a number of very important meetings coming up here very soon that we're preparing for right now. And, what makes, there's a company called Immunogen that got bought by AbbVie in December for $10.1 billion. People say, oh my gosh, they got bought. So people have no idea what it took for them to get there, right? It took much longer. But if you look back, you wish you had invested in Immunogen, right? So therefore, what you have to accept is there are very few cancer drugs that really extend life, right? I mean, just think of personal experiences with friends and family. Most cancer drugs don't work. So if you have a chance, like in our case, you mentioned it, 73% 5-year survival with our drug, 45% without our drug, with no toxicity added. You have a chance to make such a difference. You just have to go one step after another through the regulatory process, and then you can bring this drug to market. And that is essentially what we're doing.
Yeah, and I guess the key message here is just to kind of be patient, considering how valid some of these core findings are. And an anecdotal kind of side news here, I mean, your LEAPS vaccine offered promising new paradigms to treat rheumatoid arthritis. Do you want to just offer some insight on that as well?
Well, that's something else that we have going. It's a much earlier stage, but clearly we need to do much better in the treatment of rheumatoid arthritis, right? It's a huge issue for a lot of people. You've got monoclonal antibodies that cost, I don't know, almost $100,000 or more a year, and they stop working after a few years. This is a simple idea of redirecting your immune system. What essentially happens with rheumatoid arthritis is that the body attacks itself. That means your immune system has gone crazy. It turns on itself. What if you can redirect it to where it should be, where it no longer turns on itself? That's the idea of our loops. But the focus right now is Multikine. Get Multikine to market and turn the company over to one of the large companies, because the drug should be developed not just for head and neck cancer, which is from under the nose onto your clavicle, fifth biggest cancer. It's a huge problem. But breast, melanoma, anal, cervical, many, many cancers. And by the way, it's important to note here, we have shown that our Multikine is not just an anti-cancer product, it's an anti-human papilloma virus product too. HPV is a major cause of different cancers. So we have the opportunity to go after both the cancer as well as the virus that causes the cancer in some of the cases, with one medicine that's not toxic. So anyway, the key is get Multikine to market, turn it over to one of the large companies that can run 50 clinical trials at the same time and sell it on a worldwide basis. That is our task. And then maybe take some of the money and develop the rheumatoid arthritis vaccination.
Yeah, I think this was incredibly clerical, and I'll pass it over to the viewers. We'd love to know what you think. Consider subscribing, because when news and catalysts like this hit the wire, of course, we're going to bring it to you here. But on the note, we look forward to catching you in the next one.